Good afternoon, everyone.
Good morning, good afternoon. Welcome to Let's Talk ACA with JSA. Joining me is Alex Ferron, and I'm Kathy Wilson. Hi, everyone.
Hey, everybody.
Alex, how are you?
I'm doing great, Kathy. How are you today?
Good. I'm in sunny Florida with a high of 82. I can't complain.
No, me either. I am in sunny Colorado with a high of, it looks kind of warm out today because I haven't checked my weather app yet.
Wonderful.
But
Well,
it is a
welcome.
beautiful day here.
It's great. And if you're in California, you're probably at Pachanga learning a lot about Medicare. And if you're taking some time out, thank you so much. We've got some great things to cover. Hey, Alex, let's talk ACA.
Yeah, let's talk about it. And hey, you know what? You know what I'm loving today? Look at our chat. Good morning from San Diego. Good morning from
Hey, hi,
Texas. Good morning from
Texas.
New
Hi, New
York.
York.
Hey, everybody. Welcome. Thank you for joining us. This is awesome. I love
Little,
the
this will
round
be
of welcomes.
recorded. The webinar will be recorded. And just so you know, anything that you register on JSA, the ARC for any trainings, the recording will be sent to you after. And we're going to have some time for question and answers after. So let's dive into anything changing. We met once a month. We try to do this podcast every second Thursday at 1 o'clock p.m. Eastern, trying to get you up to date. We are 50 days until OEP. And I'm just getting really excited. The more agents I talk to, the more they're revving up for OEP. They've got some ideas. They are really excited to get out there in the streets and start helping more people.
Yeah, this is gonna be an exciting year for sure. I'd like to get one of those little countdown to OEP clocks in my email
I
signature
got
or
it.
something like that, you know? And again, good morning, to Colorado and Irvine, Virginia, Wisconsin. Appreciate you guys being here. Like Kathy said, everything is recorded today. You'll all receive a follow-up from us either tomorrow or early next week with the full recording of the presentation, so don't worry about taking too scrutinous of notes. We're also going to have the slides available for you guys. So if there's any links or other details in there that you want to know, just remember you don't have to put it down yourself. We're going to have all of that available for you. So let's talk about it. What do you say? Here's what we're going to be talking about today.
Some good stuff. We've got 2026 market updates. We've got short-term returns. Hopefully, we've got some more companies diving into that and posting what's available. Certifications and compliance. No new news on that. Some states, but we'll cover that. Alex's big, beautiful brain that captures the big, beautiful bill. And then Health Sherpa have a little nuance of an integration update coming in. And that's about it. I just want everyone to know that we are in the prime periods for contracting. So there is a week or two lag behind on you receiving your contracts. We are also going to post blackouts. Ambetter is in a blackout and we'll reopen next April. Blue Cross
Yeah,
Arizona, LA Care, Molina, all coming up for November 1st, and United Healthcare for October 1st. And what that means is that you can't transfer from one upline to another, but new contracts are welcome.
that's right. And I would say the two biggest blackout periods are definitely Ambetter and Oscar.
Yeah.
Those have already taken place and run through to the middle or so of next year. So if you aren't working with us yet for those carriers, no worry. Keep doing what you do best. We'll get you next year if you want to swap over, and we can give you all the details for doing so. So if you guys have attended these in the past, I want to thank you again for being with us. We definitely have some new stuff for you here, but there's a lot of important updates this year. So we want to go over again just a few of the important things that we think are worth hitting. So let's dive right into, I believe we have the 2026 market updates first, and I have just a few kind of little tidbits of knowledge. And the one thing that I've been hearing about this week, Kathy, is some service area changes. And I know you kind of sent something over to me either this morning or yesterday about
Yeah,
some UHC
United
plans
maybe?
changing.
Is that United Healthcare?
Yeah, correct. And
Uh,
actually, let me adjust this quick as well. I see a raised hand in our chat today, which is fantastic. If you guys have any questions, please use our chat function. We don't kind of have like the ability to put agents on the mic for this one, maybe in the future, which I'd love to do, or do like some call-ins from other people in the field. But if you have any questions, please put those in the webinar chat as we go through. If it's something easy that we can answer, we'll do that along the way. But otherwise, we have tons of time today. We can answer all your Q&A at the
Yeah.
end. So put that in there. But anyway, with some of the service area changes, I've been seeing a few things. And let's just say here, this is a little bit of chat. We're talking today, we're dishing and chatting. All of this isn't necessarily official yet from what we heard, but some of the big companies I heard of this year are Anthem, UHC, and Ambetter that are potentially going to have some service area changes. So let's start with UHC, Kathy. What have you kind of heard about them?
I didn't get to look at it too much. Was it South Carolina or Georgia?
Yeah, South Carolina and Georgia, I think, and then as well as Colorado, we've heard a bit of rumbling about
We
some
did hear
plan
about
changes
Colorado
there.
earlier this week. Now, have we gotten confirmation on those?
Not exactly. So, what I would say is that what we're kind of seeing here across the board is because of the changes in the ACA market this year, we're seeing a lot of rates potentially going to be increased, and these companies are filing for higher rate increases to kind of make their
Right.
bottom line. Thus, if they're in a certain rating area in various states and they don't feel that they can make up what they need to, they may see a service area reduction for 2025. So let's take a UHC in Colorado, for example.
Okay.
I know they were filing in a number of counties, maybe 10 or 15 counties, where they may not have a plan available next year.
Right.
They they should have more concrete information coming up here as to whether or not the plan will be available there. It looks like they have kind of worked out a way to make their plans available in most areas of Colorado, but it remains to be seen. And that goes for Anthem as well. That was another kind of service area reduction. So, really, I think the takeaway here is that it doesn't matter exactly where you're working. Let's use this as sort of a take it with a grain of salt example. We're going to see this as kind of a more pervasive theme this year, I think, with a lot of companies in the ACA space, not so much expansion, excuse me, as much as retention and potentially a bit of reduction just to make sure that they're staying competitive is my take on it.
Makes sense. So we have Aetna who did exit completely out of the market, and then we'll be seeing some drop-offs in some regions, depending on the carrier. And we're 50 days away, but we will keep you up to date. We've got another podcast next month, and the closer we get, we hope to have definite answers.
Yep, absolutely. And so, let me address something in the chat code here. We have a few people asking if we can make the screen bigger. I think that's because we are splitting it sort of with the video today. You should have some functions in your Zoom to change the size of the actual presentation or reduce us to more of like a thumbnail. Feel free to experiment with that. But otherwise, again, don't worry too much. We'll have the full recording for you. We'll have all the information on the slide so we can just kind of discuss things today and we'll give you follow up with more information afterwards as well. But I do apologize if that's a little bit hard to see, but monkey around with it, and we're going to keep moving on. Am better is an interesting one that I want to touch on. Now, definitely take this with a grain of salt. This is nothing that I have concrete information on, but from personal experience, I was contracting an agent this week in the state of Michigan, and Ambetter comes back to us and they say, okay, we're putting a pause on new agent contracting in the state of Michigan. So to me, that normally means, hey, we're not looking to take on any new business. We're going to keep
Wow.
up with the agents that we already have, but we're not onboarding anyone new. I think it's highly likely that we're going to see better service area reductions in Michigan this year as well. And Detroit market has traditionally been kind of a hot area for them. So keep an eye on that one if you guys are working in Michigan.
Yeah, and that's happened before. We have hold on contract acceptance like AvMed. I think maybe what was another company that you just go on a wait list. Kind of
Absolutely.
like, we're good right now. We're going to try to maintain with retention and all of the changes happening. And for whatever reason, they put a hold on contracting. So good news. So that's just Michigan that we've heard of so far.
Yep,
And
that's it
hopefully
so
that'll
far.
be it, right?
Yeah, absolutely. And I mean, I've heard a few rumblings from some of the other carriers as well. Molina, Oscar, what's one of our other big national ones like Cigna. I think
Mhm.
it's going to be definitely a theme this year that they're going to stay in their traditionally strong areas. If you guys have any questions about where the products have performed this year, we have all the rate information from 2025.
Right.
Please let us know. That I think is going to be a good indicator of who's generally going to remain competitive for next year. So just let us know about that. We don't have any 2026 rate information until usually a week or two ahead of open enrollment. ACA is really last minute, you guys. So I know we get asked about that every single year just to preface it.
What else we got?
So, two more things on this slide I want to hit on, and we're going to touch on Health Sherpa a little bit more in depth on the next slide. Again, if you guys are a bit unable to see the full screen, the next slide will be a bit wordy, but don't worry, we're going to have that over to you with the full slides in PDF format. So, the big one I want to always hit on again is Illinois. That is the only marketplace we're seeing this year that's converting from the federal system over to a state based exchange. So, with that conversion, Kathy, what are kind of a few things that that means for agents?
That means that your federal facilitated certification is not valid for Illinois anymore. You'll have to do a separate certification and then use a separate exchange platform.
Yep, that is the long and short of it. You have to get set up with Get Covered Illinois. That is going to be the name of their
Get
official
covered
health
Illinois.
marketplace. You're going to have to use their own certification platform. Sorry about that again. Let's say hi again this week, Peanut. Hello,
Peanut loves
that's
to join us
Peanut.
every time.
It's
Peanut
Peanut
is
the
the
ACA
ACA
cat.
mascot.
Yeah, if I ever start my own agency, she'll be my logo for sure. She's always with me on these chats, everybody. So give a wave to Peanut. I think she'll be joining us every single week as long as I'm home here doing these webinars. What a sweet girl. So anyway, Illinois converting to a state-based exchange. No more Health Sherpa. Got to use the Get Covered Illinois website. We have some important certification dates for you later on in the presentation, so stick around. We're going to talk about what you need to do to get selling in Illinois if you aren't already. One tip if you are already selling in Illinois, try to pull as much client data as you have there. A lot of times, carrier portals are going to integrate with like what the marketplace reports, especially if you're working there with Aetna. Aetna has traditionally been a really hot product in a lot of areas of Illinois. Try to pull that client data
Yeah.
because if Aetna pulls out of the market, if Illinois switches over their system, that's not necessarily going to be available to you through your
Right.
carrier portals anymore or your Health Sherpa. So get that to make sure that you can touch base with those clients and continue marketing to them efficiently.
Yeah. Um, and we have a lot of agents that are trying to secure their book of business to make sure because we never know how the integration is going to roll out. We hope that the state will integrate properly, but we definitely don't want to lose any clients.
Exactly. Yep. So be proactive. Again, we keep saying that proactivity is really I think the theme of this year if you're going to be working in the ACA and
Yeah.
get that information out of those systems and somewhere secure that you can access, even offline potentially in the future. So let's talk about Health Sherpa a little bit. I think that is sort of a good segue. And I'll say this that it's going to seem annoying, but it's nothing that agents have worked with in terms of working with Health Sherpa before that is anything new. So this is something that will definitely maybe make you grind your teeth a little bit when you do an application.
Health Sherpa has our back. Look, they're looking out to secure our identification as if someone would want to log in and do enrollments for us. That's usually not the case, but it's probably about a 6-step authentication to get in. It's quick. It sounds like a lot, but then there's a new change that happened.
Yeah. So I think, Kathy, you'd be a good person to kind of speak more on this with your experience of Health Sherpa. So the long and short of
Mhm.
it is that in the past, when you accessed your Health Sherpa account as an agent and you needed to do certain things, they would make you reintegrate with your FFM or your federally facilitated marketplace
I
profile.
think it was every 12 hours
Correct. It was
or
every 12
more.
hours. And like Kathy said, it was really just to kind of add that level of security and make
Yeah.
sure that you are the agent doing the stuff on the profile. So now it's no longer 12 hours. They're cutting it down to 30 minutes. So
Yes. Yay.
every 30 minutes,
Yeah.
if you aren't continually logged into your Health Sherpa account, when you go to do something on your account that requires that integration, they're going to make you do it again. So, like you said, Kathy, there have been some times in the past where you've worked in this platform. What's
Right.
that kind of like integration process like?
It's a click, click, texting your phone or your email, however you have it set up. Guys, write down your passwords and have them available to make sure that that's not a hold of when you're doing enrollments, especially if you're going in and out. Maybe it's not something you're working on full time and have health Sherpa, but now it's every 30 minutes. So
So
have
I would say,
yeah.
be prepared to do that pretty much anytime you
And
log.
click remember me, right? And so you'll have it set up, but just know there's a lot of different steps to authenticate your and verify who you are.
So it's kind of like you get in, you do the two-factor authentication. Do they make you sort of like log into your CMS profile as well?
No,
As how it works?
click and it well, I'll have to go through it again. We'll cover that on the next podcast of exactly the steps taken. But you click on it, and there's a integrate button, and you do that, and yes, it automatically logs you into your CMS. So you've got to have that login as well. But we can cover all that. I have slideshows to share for that.
Nice. That'd be a good one.
Yeah,
Maybe we can touch on that next month, especially with us getting closer to open enrollment. That'd
sure.
be some good practice. So, in general, this is something that has been active for like a week already, from what I could find. So,
Right.
some of you may already be experiencing this. So, just as kind of a summary here. Basically, anything that involves messing with a client's marketplace application, syncing their application with the marketplace, submitting any kind of documentation for maybe their subsidy or an SCP, that's going to cause you to integrate. However, if you're just poking around in your profile, or if you are just quoting and shopping around for plans once we get to the first look, you're not going to have to reintegrate for that. It's really just what you need to do to be working with clients.
Right.
I saw a couple questions in the chat here. Are we talking about Illinois only? Nope. Just they're the only marketplace we know this year that's changing from the federal platform to a state-based platform. These are just general national ACA market updates. We're kind of touching base on new topics every week and a little bit of everything. So let's see here.
What other knowledge do you have to drop on us, Alex?
Well, let's talk a little bit about what the hot topic has been in the market lately. The One Big Beautiful Bill Act. So the first thing I want to touch on again, as this is going to be probably the biggest change to the marketplace this year, is the enhanced subsidies. You may have seen this as, extra help, ETC, that stands for Enhanced Advanced Premium Tax Credit. This is where, since 2021 in the American Rescue Plan Act, we saw expanded subsidies where people in the six-figure ranges of income, just a husband and wife, especially as you get up into the 50s and 60s, these folks are traditionally kind of your demographic that don't get a lot of subsidy towards the marketplace if they're higher income. We saw the expansion of the subsidies to actually give these folks money off of their plan's premium every single month, when traditionally that wouldn't have happened. And it wasn't a ton, maybe 100, $200 a month for both a husband and a wife in a lot of cases. But this really helped make a lot of marketplace plans even more affordable, and it expanded the income ranges by which subsidies actually granted to clients. So, big takeaway here is that is going to be going away for 2026. And again, Kathy, I think you said this best before. This is really a return to form, right? This is how we've operated in the past.
Now, Alex, I thought the courts were doing a strong push to see if they can extend that. Has that been a final ruling?
So, not exactly, but also kind of yes. So this is where we get into sort of a little bit of gray area here with, I would say, sort of different legislative bodies battling each
Right.
other. What I will say is that it is extremely likely that these subsidies are going away this year. They haven't taken the time to actually extend the American Rescue Plan Act that
Right.
expires at the end of this year. So that one
Right.
I think is highly likely that we're not going to see enhanced subsidies anymore. But however, if you look at your screen here from what you can see, hopefully, I have kind of that X out here. These were some of the previous One Big Beautiful Bill Act highlights, which we talked about. And now we're seeing something very interesting happen here. So let's move right along.
So
I have a
before
little
we
bit
move on,
on the next
Alex, just
slide.
to clarify, as an agent, when I hear subsidies, and there's a difference between enhanced subsidy and a subsidy, correct?
Correct. Big
Okay.
difference.
And that's so what we're talking about is the higher income levels. That's the enhanced subsidy, meaning that it was extended to higher incomes, and that's what's going to be in question. So that American Act
Correct.
will expire in 2025, maybe, most likely.
Most likely. I think
Most likely.
and I'm glad you touched on that. I think this
Yeah.
is probably the biggest conception I see with these is that no, subsidies aren't going away entirely.
Exactly, and that's the questions I'm getting because, we're agents just in the field, and we just hear keywords, and we're like, "What?" But hey, we're not talking about subsidies. Subsidies are still here to stay.
Correct. Subsidies are here to stay. You know, people within kind of your income ranges that fall within the federal poverty limit chart. And actually, here's a good example. Let's use this as our
You're
example.
talking about 400%?
Yeah, so
Yeah,
400%, this is what it's gonna look like for 2026. So I think 2 key, kinda numbers here, and I'll just read these out for those of you that might have a kind of a tiny screen today. Around 85,000 for households of 2, and 130,000 for households of 4. These are gonna be essentially your hard cutoff income ranges. This is adjusted gross income, annual income for a
right.
tax filing household. These are gonna be your cutoffs where you're no longer gonna get subsidies. When we say enhanced subsidies, that's where we meant that people beyond these income ranges and within these income ranges got either subsidy for the first time because they were ineligible in the past, or they had a higher amount of subsidy due to them being expanded and more help being offered through the federal government. So, this, as far as I know, is going to take place across all platforms, federal and state based. However, if you're working in a state based exchange like California, Washington, Colorado, now Illinois, these states do have a little bit of their own method for kind of generating subsidy and how that's calculated. But generally, these are going to be the amounts that we see where the hard cutoff is. So, again, about 85,000 households of 2, around 130,000 for households of 4. Those are going to be your hard cutoff amounts again for 2026, likely to not be expanded any further. Subsidies are still there, though. That's the big takeaway.
Good clarification. Thanks.
No, thank you. I know we always get that question, so I think it's important to hit on it here. So here is the big update from the last couple of weeks here. And really, what it is a U.S. District Court in the state of Maryland has essentially declared, for lack of a better word, that some of the One Big Beautiful Bill Act provisions affecting the marketplace and the CMS final rule are considered unconstitutional. So, as it lies right now, these are the changes that will, or in this case, rather will not be going into place. And we have to see if the government is going to appeal this decision. They kind of have to adhere to it for the time being. So we just have to wait to see if there's going to be any changes. But that's why you guys are here today. This is why we started this year, because with all the changes, we want to keep up with it. So let's kind of talk about,
Break that down for a minute just
yeah,
for, for me to understand in my head. So what you're saying is earlier the your big beautiful brain bill had put out some regulations. We
yeah,
were training on those. Now Maryland has a court ruling trying to say they're unconstitutional, and now there's a temporary hold on those regulations, meaning that
temporary
they're not
hold.
going to be effective possibly until we hear further of 2026 open enrollment.
Yeah, perfectly summarized.
Okay.
And I think temporary hold is really a good way to put it. And the main reason being is that, again, these were provisions put through Congress and the federal government and a pretty big sweeping bill that went through the House and the Senate. So it's possible we're going to see a federal appeal of what's going on here.
Okay.
And trust me, I am not a legal mind. I've been doing this for 8 years now, 40 hours a week at the very least. So I am fully ingrained in insurance world. So as far as the
Yeah.
legality of all this, I want to touch more on what the actual effects and the ramifications are. So a couple of the big ones that we might not actually see change here are on this slide. And I think a couple of the biggest ones are right in the middle there, where it's the $5 monthly re enrollment. So this is where if you had a client going into 2026 with a $0 premium because of their subsidy, if they didn't essentially verify their income again, they were going to be hit with a $5 fee, for lack of a better word, when their plan rolled over. And this would be like a monthly $5 premium until they appealed and they proved their income. So now the court is saying that this is an unconstitutional or it's unlawful. So as it stands right now, automatic re-enrollment will still happen. This is for your $0 premium, and really everyone. Automatic enrollment will
For
still
everyone,
happen
right.
for 2026, and there's not going to be any sort of fee tacked on. That's the way it stands right now.
Tell you what, Alex, I was thrilled to hear that there's a temporary hold, and we really are hoping that the hold is extended and that it's a permanent because that's a lot of changes we've been, trying to be proactive about and to not have that hanging over you to make sure you do this and make sure you do that, which is it's great protection for your clients, but it's a lot of changes that we're not just used to doing. And so what else do we have on that we can look forward to?
No, I agree. And just to speak to that quickly, we see a lot of these changes made in the interest of consumer protection. The ACA has traditionally got a lot of complaints from call centers. So things like this are oftentimes done from a government standpoint, not working with people who are day in day out doing this like we all are, and it really hurts a lot of the bona fide agents that do their job well and are just out there to help clients. So some of these changes I think are really going to make your lives easier. So we have the $5 automatic enrollment fee. As
Okay.
it stands now, that's going away.
Yep.
Now, two of the other ones are past due premium reconciliation. This is one where they ruled if a client has any sort of past due premium with another carrier or with the marketplace, they could essentially say, hey, you got to settle up before you enroll again. And I know we see this in Medicare sometimes, but oftentimes with the marketplace, especially with these changes, you're
Mhm.
working through a government entity. It's a lot slower than working with just a private insurance company. So allowing these people to enroll, settle up their debt after the fact, that is beneficial for both the client and the agent. You're not going to be stonewalled just because a client has an existing past due premium or maybe a debt that they're not even aware of. So this allows more seamless enrollment as we go into 2026. That's another one of the big changes.
Yeah, and I wasn't even sure if it was same carrier, if the issuer meant the carrier and then having a past due balance and not being able to go to the same issuer. But since that's not, still on or on hold right now, we really don't need to be concerned too much about what it meant before.
Yeah, that was the way I kind of interpreted it as well. But the marketplace communicates their data with so many of these carriers that
Hmm.
they'll also know, like, if a client has a past due premium in a lot of cases with a different carrier that could prevent them from enrolling into a new one. So we're just not going to see that crossover, thankfully. Or, again, unless we see an appeal, this is the
Right.
way it's going to stand now. So, two of the other ones that I think are really helpful our SEP verification. The court has
Yeah.
essentially, in so many words, said that this is too burdensome on both the client and the agent. So they're going to allow the SEP enrollments to be more seamlessly integrated into
Yeah.
the marketplace enrollments going forward. If the marketplace does require any of that documentation from the client, they will follow up with them afterwards, which has kind of traditionally been the process here. If they need something like a loss of Medicaid letter or a loss of coverage letter from their job, they'll allow the enrollment to happen without pre-verifying that, which
Yeah.
we were expecting to take at least 3 to 4 weeks in a lot of cases going forward.
Yeah. So let's just make sure that we're getting immigration status documentation. That's a must.
Yeah.
Everything else looks like we're back to normal, right? And
Yeah, a lot of these verification changes are apparently not gonna happen, and another one was kind of a two-parter. They call it like a heightened income verification slash a failure to reconcile tax data.
that's right. Now,
Yes.
rumor always had it, nobody ever really knows too many people that didn't reconcile their taxes and weren't eligible again for the marketplace. I've always heard rumor you could go maybe 3 years, but now what this is saying is it's also unconstitutional to not allow someone to have the marketplace again for not reconciling their taxes.
Correct, yeah. They usually if they were able to pull the last 2 years of IRS data to verify your income, that was usually what the marketplace was doing unless they needed
Right.
it, proved some other way.
Right.
They're basically saying, "Hey, you can't prevent people from getting healthcare due to something with their taxes that we just can't pull up automatically. If you need that verification from the client, it'll still be provided, but it's not going to be as stringent as it was essentially labeled in the One Big Beautiful Bill Act. And I see a lot of questions coming through in the chat here. This is fantastic. Again, we'll touch base once we're done
Yeah.
with this. We got some time left. So let's keep moving along. I think those were the three most important things that we might see not.
So we may not have to do income verification. New premiums aren't going to be a problem. No $5 charge for 0 not re-enrolling. We will be able to re-enroll, so that's an additional. We won't have to put documentation for SEPs, and there'll be no consequence, let's say, for not reconciling your taxes.
Correct. So I guess, a solid five good changes in my
Yeah.
opinion. There's another one on here. I have it labeled as adjustment and actuarial changes. This gets a little bit more in depth. I'm going to attach a copy of the article from the U.S. District Court in Maryland with our follow up if anybody wants to look further into it. All that really means is that there's going to be some behind the scenes pricing stuff that the marketplace does that will be essentially done the way it's always been done, where we expected that to maybe have some higher rate increases this year due to how they're pricing silver plans. So, in general, we hopefully may not see as much of a rate increase or also as much of a subsidy reduction, although the enhanced subsidies are still going away.
Right. And
So
that's a
just
lot
keep
of
that in
words,
mind.
right? That's a lot of words to explain what we're trying to
It is.
say
It
here.
is.
Basically, if you see the adjustments and the rate changes, this is the definition behind it and how they do it and why they do it with the cost sharing and the risk involved and the overpricing or price adjustments that they're going to do. So if you have to dive into that and you're wondering why such changes are happening with silver plans, that's basically it.
Exactly. And trust me, you guys, I've banged my head against the wall with some of this stuff this year. It's
Sure.
not easy to understand. So we're trying to just give it to you in at least a somewhat digestible format. But
Listen, never did I ever think I would be talking about what's happening in the court system.
yeah, unfortunately, that seems to be part of our job this year. So we keep up on it. That's for you guys. But if anybody wants more information on that, we can certainly hash it out after the fact. But let's talk about another recent change that we saw in the market just from last month. Some of the short-term medical changes. What's
Oh,
going
this is
on here?
good news.
I
This is
agree.
a celebration. Yay, short term. Welcome back.
Yes. More options, guys. More
Yeah.
options is always good. We like to see competition in the market. And especially in a time where if we're going to see subsidies go away for certain clients or subsidies be reduced, if we're going to see plans pulled out of certain marketplaces, we need to have the options, right? That is
Yeah.
where short term can potentially come in as a more viable measure for your clients, your healthy clients that just need something that's a little bit more of a blanket piece of coverage.
So you have more experience with short term medical. I haven't written a lot of that. More Medicare and ACA. What would you say if someone was saying how comparable short term medical pricing is to ACA? Is it something we should even compare and look at for an alternative, or is it just such a vast difference that it's not worth looking into?
I think that the plan structures are comparable. What they cover is a little bit different, but I think price is actually the thing that we should be comparing the most. And really, what we're comparing is the price of like a full priced ACA plan in a lot of cases, because you have clients that because of the subsidy, the way the ACA operates is they're only paying maybe $100 a month.
Right.
But if they were to have a much higher income, that plan would maybe cost $500 to $600 a month. So if we look at the cost of a full priced ACA plan versus something like a short term medical plan, I'm usually seeing the premium of a short term to be about half of that cost.
Meaning no
Average.
discount, no subsidy, no credit on
Correct.
the ACA plan compared to a short-term medical pricing. And how is short-term medical quoted? What are the variables there?
So, first and foremost, these are private plans as well. So, short
Right.
term medical is something sold privately by insurance companies. They're not going to have any kind of subsidy or income verification or anything like the marketplace. Now, in terms of actually doing the enrollment and how the plans operate, these are all going to be done privately through whatever companies you onboard with. The enrollment and the benefit structure is going to look really similar to an ACA plan where you have
Okay.
your high deductible first, your
Okay.
copay and your coinsurance to a maximum out of pocket.
Are these underwritten?
They are. These are underwritten
Okay. Big
products.
difference.
Big difference. So I would say the biggest difference between short-term medical and ACA, and don't get me wrong, not all of your ACA clients are going to be right for short-term medical and vice versa. Short-term is an underwritten product. It's a pretty simple, it's usually simplified underwriting. You're going to know right at the point of sale whether or not your client qualifies. However, they do not cover pre-existing conditions. That's the biggest
Okay.
difference between these products in the marketplace. Short-term medical is not going to cover pre-existing conditions.
Short-term medical does not cover pre-existing conditions. That's a
Nope.
big deal.
Very big deal because the marketplace, these plans aren't underwritten. You just need an election period to apply or, be eligible to get a plan. And they do cover pre-existing conditions. So in my mind, where I would go with this is okay, what's a good short-term medical client versus what's a good ACA client, right? Because again, they're not going to fit the bill. Everyone's not going to fit the bill both ways or vice versa. So I think I have two good examples for you here very quickly. It would be first off, healthier clients, ones that maybe need coverage from like one job to another. If they have to wait out a probationary period at work, maybe a few months, they're changing jobs. If they're a gig economy worker and they only have coverage through their job for a certain time of the year, that's a good short term medical client. Or your higher earning, maybe slightly older clients that are in their 60s in the marketplace. Hey,
Okay.
we make 100, you're a financial planner, they're not going to get any sort of subsidy. That ACA plan's real expensive, right? They just
Mm.
need a year of coverage for the time being. Maybe you write them a short term medical plan if they're healthy enough. It's about half the price of that ACA plan, still gives
Okay.
them that safety net to get through to next year. And then they can look at plans during open enrollments again.
Perfect. That gives me a better idea of how to characterize or categorize different types of individuals and what might benefit them better. So, perfect. Now I know who would benefit from a short term policy. And before it was only 3 months. Now it's 12 months for some, not all, depending on the state and the carrier. And you can go from policy to policy or issue
Usually.
year to issue year with the same carrier. And you couldn't do that before.
Yeah, not with the last regulation, and it does
Okay.
depend on the state that you're selling in here. There's a lot of state law that plays into these products. So basically, what this all stemmed from is that regulations changed last year in September. Now we saw a statement from CMS in the last month that says, "Hey, we're not going to enforce this anymore. The 12-month plans are back on the menu." So far, we've seen Allstate and Pivot Health follow suit. I have a meeting with UH1 tomorrow. We're going to see
Oh,
if we have
good.
any updates
Okay.
from United Healthcare slash Golden Rule, if you guys have worked with them in the past. But here's a good example of Pivot Health, one of our top national short term medical carriers. This is their most up to date product availability chart. So you can see here the product durations. And the cool thing with Pivot Health is they have what's called a tri-term plan. So in a state like Florida, you can actually do one application, one instance of underwriting for 3 years of back-to-back coverage.
Oh, nice.
Yeah.
So
Oh,
pivot, this is pivots in the blue. Is that what you're saying?
yeah, so the dark blue is the
Yeah.
longest duration. That is the 3 times 364. So essentially,
Nice.
a day less than a year. I don't know why they have to file it that way if I'm being totally honest, but, it's essentially 3 years of back-to-back coverage on
Okay.
one instance of underwriting.
And who do we have available for short term with JSA right now?
So right now, our top 3 carriers are gonna be Pivot Health,
Okay.
Allstate, which was previously National General, and United Health One Golden Rule. That's a United Healthcare company.
Whom we're waiting to hear if they're going to go 12 months, or do we think that they are?
I think that they will. I think that they definitely will follow suit before open enrollment as long as there's no other changes on the side of the market. So we just have to wait and see what they do. But again, I would expect them to follow suit. I see a quick question here in the chat as well from Alicia. Is there short-term medical in New York? No, New York does not have any short-term medical. Same with the state of California. So like we said, there's some state law that plays in here. These products might not be available everywhere where you're writing. So just a
So
head.
Daniel says that he quotes Pivot a lot with no medical underwriting.
They do have some products that don't require medical underwriting, but I am very confident in saying that short-term medical is an underwritten product.
Is that maybe called a guaranteed issue, something?
Yeah, Allstate actually has a guaranteed issue short-term medical plan, so they are out there. Pivot potentially could have added one as well.
Got it.
Generally, those are quite a bit pricier of a product, and they still do not cover pre-existing conditions. So just be
Sure.
aware if you're selling a GI short-term medical through one company or another, it's probably still not going to cover those pre-existing conditions or pre-existing prescriptions, which is something that I run into every once in a while. Quick, I don't think there's anything too prudent to touch on here, and then we'll have a Q&A section, so we'll go back through the chat chronologically and answer all your questions. So certification and compliance, just a quick little hit that we want to touch on here. Biggest one I keep getting is, Alex, when can I do my FFM certification? I don't know.
Oh, so I tried to do mine because I was searching on the web, the great big web, and it said, quote, it opened up on 8/6 in many different articles and statements. So I spent the whole weekend on FFM with CMS using chat, my best friend, Chad, I call him, and putting in the errors of every time it wouldn't let me add an application or do this, and it was telling me all different types of things to do as an agent. Oh, well, you're not listing your organization. Oh, you don't have this and you don't have this. Finally emailed the help desk. Well, sorry, we're not open yet.
Kathy, I salute you. You are a trooper for going through and confirming what I'm sure a few of our other agents would have done
We're
were
not open yet.
yeah, were
Like,
not for you.
okay, are you
So
when you are? No.
So just to speak on that very briefly here, CMS always closes down their certification during the summer while they prepare the next year's platform. Traditionally, that opens up about mid to late August. Pretty late this year. I would say we're about 2 to 3 weeks solidly late at this time compared to
Golly.
years past. So just keep an eye out. We're going to put out communication the day of that these are available. So, you can actually go to healthsherpa.com. You can sign up for alerts as well if you want to know when this is available.
You
We've
guys, if you're
done
signed up on Health Sherpa, you're gonna get the alert the same time we do. We will also put a blast out. I will try to remember I have a wait list. If you wanna be on my wait list, be sure to email me and I'll put it in the chat at ACA@jsaonline.com.
Yep. So a little bit of a holding pattern right now, but we do expect that to be released within the next couple of weeks. And then as soon as that's available, just remember if you certify for 2026, certifies you for the rest of 2025 as well if you haven't done that so far. Other ones to touch on here, we already have Georgia available for certification, Colorado, Maryland, Illinois, and Illinois, your time frame is up to October 17th. So you got about a month and a half, month and a week. Get it done right now. If you want to sell in Illinois, they are ready to go. Go to getcoveredillinois.com. You can do that right now.
So that brings me to a question. Is there a cap? Is there a close date for 2026? It sounds like maybe for state-based?
Maybe for some state-based ones. Yes,
Oh,
state-based
wow.
ones do have time frames. If you're questioning any of those, just let us know. We can help you look into that. For
Okay.
CMS and the federal marketplace, they do not have a time frame for certification. You can do that at any time, even up through open enrollment. State-based marketplaces, they always have a little bit of their own rules. So if you're selling in a few different states and you're curious, just email that ACA inbox like Kathy posted in our chat. It'll be in the follow-up as well, and we can let you know exactly what you need to do. So last thing I want to touch on here is again, you're going to get all the slides from us. Right at the top here, I have this compliance refresher. This is a hyperlink. CMS put out a presentation 2 weeks ago on some compliance best practices for marketplace agents. If anybody is looking for a nice little refresher with what you need to do, this applies to the federal marketplace. Go ahead and click that link during our with our follow-up email that goes out to you guys, and you'll be able to view the slides from that presentation as well as a recording. So a little bit of best practice there if anybody is curious.
Great. Well, Alex, I can say that with all of the new information that's come out, I am even more excited than I was at the beginning of this podcast, especially if I was an agent that didn't wasn't aware of the updates that I can breathe a little easier knowing that I don't have all these stringent requirements and regulations that would be new for 2026. So this is good news, guys.
I agree. And it's always the case where a lot of things get announced. Everything is pedal to the metal every single year. And we see all these regulations come out and it ends up not impacting your business as much as it seems like it's going to. And so to see some of these changes reversed, it's a little bit of our, that weight off of our collective shoulders. So I'm very happy to see some of this. And, this exciting is the best word. It's been an exciting year. We see changes constantly. So we're keeping up on it for all of you joining us today. So let's go through a
Yeah.
little bit of Q&A. What do you say?
Yeah, I want to cover some blackout dates just one more time, guys. This is for your and our benefit. We want your contracts. We'd love to have you under one household. And you're probably not with us unless you've recently come over because we didn't have contracts before. But now we do, and we can support you with your business for ACA. So keep in mind that we are coming across United Healthcare 10-1, and that's, of course, for transferring. We're just talking about transferring from one upline to the other. 10-1 is the blackout date for United Healthcare. And then 11-1 is our next blackout date. That's Blue Cross and Blue Shield, Arizona, LA Care, which is in California, and Molina.
Nice. Always good to hit those
Gotcha,
again.
Alex. Let's do some questions and answers.
Yeah, let's do that. I'm
Q&A.
gonna I'm gonna scroll to the top of
I
the
don't know
chat
why I say it
here.
out. Nobody says questions and answers for me.
I know Q&A is the universal term, right? Awesome to see all those good mornings and good afternoons. That's so fun. Thank you guys. Alyssa in Colorado, what's up? My fellow Coloradoan. Carla says, love the shirt. Awesome. Hey, I gotta thank Kathy for these. She put these together. These are so cool.
These
A
are
little bit of Gen
actually, I
Z
have to give
swag.
the credit to our fearless leaders onto Turner. We took this from our DSNP, and it's just because we're cool like that, right?
Yo, shout out to Anta, our fearless
Yeah.
leader indeed. Okay, so I think the first question I see here is Rebecca asked, do ACA carriers provide first looks like in the Medicare space? Yes and no. So, usually around this time of the year, we're seeing these carriers host sort of their summits for what their plans are for the next plan year. They provide some information in there, but again, we don't see final plan details, service areas, and rates until maybe 2 weeks at the soonest before open enrollment. We might see a little bit of service area footprint before that time, like late September, early October. But rates and window shopping, we're never going to see until at least a week or two before open enrollment.
And is that true to say a week before they will have it live for the new rates?
Yeah, specifically with the federal marketplaces, states usually follow suit or they do their own thing maybe a little bit earlier. But I would say
Sure,
about a week before
sure.
marketplace opens, you're going to be able to go to healthcare.gov or Health Sherpa and do sort of sample quotes for 2026 rates.
And the state-based exchanges, they still follow the federal regulations for things. They just have different timelines on how they do things.
Exactly. I'm moving right along. Joel asks, will California be an exception to the cutting of the subsidies? So again, California is a state-based exchange. Generally, we're going to see subsidies across the board go down this year. They may have a little bit of their own algorithm. So we're not always exactly privy to how the marketplace calculates that. There's a little bit of, some stuff going beyond behind the scenes. We don't exactly know how the sausage gets made. So I expect subsidies in all states to go down this year. That will include California, but might not be as drastic as federal marketplace states. That's the best I can answer your question right now.
We'll see if his predictions pan out
I hope
in
not. You know,
26. We'll play this back and we'll see what happens, right?
California got a lot of people. Let's sign them up. Give them some money
Yeah.
off their plan. Caprice asks, what happens to those people who are in states that expanded Medicaid? Will they lose coverage due to reduction in Medicaid payments? It's possible. We are going to see through the One Big Beautiful Bill Act a reduction in Medicaid beneficiaries over the next 10 years. The Congressional Budget Office estimates anywhere between 10 and 17 million people losing Medicaid over the next 10 years. So, say about a million a year, roughly. Those clients that lose their Medicaid status, they will be eligible for the marketplace with a denial letter. So, they might lose their Medicaid, but again, maybe a good opportunity as these are usually lower income people to get them into a marketplace plan.
Yeah. So if you're thinking about those that are on Medicaid that are below that federal poverty level to get them that subsidy, and if they get kicked off of Medicaid, it's an opportunity for them to get on to the marketplace and they probably make enough because they got kicked off of Medicaid, which means they make too much, right? That's why you're getting kicked off, which makes them possibly a subsidized zero silver plan. It's a
Correct, and
win-win. I mean,
exactly. I mean, unless it's the case of like a disability Medicaid, where I
sure.
know they're going to have some different kind of like work hour requirements going into next year. Those may be some
Right.
outliers, but generally, we're going to see more clients filtering in from Medicaid to the ACA.
You
I
guys are
think,
in the Medicare space, you're already seeing that, right? We've already seen some effects of that, and so that will increase more for both lines of business.
yep, exactly. Let's see here.
Go Packers.
Yep, couple of Go Packs. I was born and raised in Wisconsin. I've been living out in Colorado for the past 5 years. So, you're born a Packers fan if you live in Green Bay. It's beaten into you with a cheese head from birth.
So, Miss Davis has a question about which method of enrollment. So, some of the carrier portals you can do enrollments on. Usually, the catch-all is Health Sherpa, unless there's a upline that uses a certain other platform, or you have your state-based exchange. But like United Healthcare, you cannot enroll for individual family health. So, for ACA, so Health Sherpa is the way to go.
Right, like, if you try to do that through United Healthcare's website, they just direct you to Health Sherpa.
Right. Some
So
carriers you can, but why break it up like old days of Medicare? Go to this carrier, go to that carrier. No. We want easy, right? Easy access, one place, and that'll house
exactly.
all your book.
So Health Sherpa, if you're working through the federal government, the federal marketplace rather, excuse me, and if you're working on a state-based exchange, you have to use their website. As far as I know, I get asked this every single year again, there's no platform that combines all of that. There's just too many moving parts, too much data going around. I don't
Mm.
think it's going to exist anytime soon either. Just let us know if you have a question on what platform is best to use. We can help you with that. Catherine, where can we learn what carriers will be available in 2026? All but one of my clients are with a carrier that is leaving our markets. Aetna is the big one we've already heard announced. They're going to be exiting the market for 2026. For the carriers that are remaining in the market, we're not going to know service area reductions for a little bit still. Medicare, they're really on top of it. We get information pretty soon every single year at the end of summer. ACA is not the same. The filing goes on all throughout the year. These people are changing their plans up until last minute. Service area and county availability, state availability is something that we see first, definitely before rates, but I don't expect to see that for another couple of weeks.
Right. And the client will get notification
Correct.
pop for anyone else, right?
Yeah, Aetna's a good example. Like we
Yeah.
said, I mean, they're exiting entirely, but we've seen non-renewal letters go out to clients already dated as early as June.
Yeah.
Das asks, covered CA 26 certification is open? Yes, if you are in California, you can go ahead and certify right now that is currently open for the next plan year. Rebecca, do we know if there's a window of time prior to November 1st, that's open enrollment, where changes can't happen? For example, if the final ruling is out on October 20th, that's a lot of change with short notice to comply. I absolutely agree.
So we agree with you.
I absolutely agree. We saw the CMS final ruling, quote unquote, effective as of August 25th this year for the
Right.
marketplace. We talked about that on our last presentation, but now we see through this district court ruling that there's going to be some changes still. So this year is all up in the air, for lack
Yeah.
of a better
The
word.
more reason to tune in next month on the second Thursday at 1 o'clock PM for Let's Talk ACA.
We're going to keep up to date on it as much as we possibly can, but we see carriers changing their rates, even up to a couple weeks right before open enrollment when they release them. So I would say generally it is like mid October when most of this is solidified, but we see funky stuff happen every single year. So we're just going to stay up on it for you guys. Caprice asks, if someone does not qualify for a tax credit, can they still enroll in a catastrophic plan? Do all carriers have to provide a catastrophic plan? So I said the word catastrophic in the sense of like a short-term medical plan, just giving your client a safety net, a stop loss limit on their financials. So it depends on your definition, but to speak to the bigger point, if you don't qualify for a subsidy because your client make too much money, they can still enroll through the ACA. That's a common misconception. They can get a full price ACA plan as long as they're eligible. That's perfectly fine. So if you consider a bronze plan with a $9,000 deductible, a catastrophic plan, then yes, they can still enroll.
But they're not eligible for the advanced tax credit.
Correct. They're just going to pay full price, but they can still get an ACA plan. Jacqueline, any updates on DACA recipient eligibility? That was not touched in the U.S. District Court ruling of Maryland. DACA recipients for 2026 are not going to be eligible for the marketplace.
Tell them what DACA is.
Deferred action child something. Basically, it's child immigrants in America who have temporary resident status.
Exactly.
Colette, seems like there might be some opportunity to do short term with an indemnity. Yes, a lot of short term plans you can tack on accident, indemnity,
Well,
critical
I've got some
illness.
agents doing the exact same thing, and
Short
they
term is a good cross sell
yeah,
candidate.
with indemnity. Yep, you're right on it.
Correct. Gene, still no Illinois short term medical. Correct. Yeah. So that's where the state play comes in. When the federal regulation was introduced last year, Illinois also changed their state law. So, until that changes, no short term in Illinois. So you are correct, Gene. Colette, thank you. I love the format here of a conversation between Alex and Kathy. Hey, we love it too. That's why we started doing it. Let's see here. We answered the UHC question. How can I get contract with Pivot Help, Allstate, and UHC? By talking to us. We can help you out with that. We have all those contracts. Just send an email to aca@jsaonline.com. We'll get you hooked up. Let's see here. John said, I just received
Oh.
emails from
Oh,
CMS on
John.
webinars to be held next week for Plan Year 2026 FMF training for new and returning agents. Awesome. Cutting edge. So things might be going out to agents right now for training next week. We
Guys, this
usually,
just in, news break. John has reported that here is the 2026 we haven't checked our email, so maybe it's come in through that time. Thanks for the update, John. I
Thank you,
know.
John. John Callahan coming in with the hot off the press news. So keep an eye out. They usually do kind of like a training walkthrough for new and returning agents a couple days before that's actually released to the public. So
And I'm gonna do
it's
one
next week.
well. Yeah, that's why I was hoping to get on because I've been through their guides and trainings, and sometimes I still get lost, guys. So I wanted to do it with screenshots so to make it as easy as possible for you guys.
Yeah, so we'll have some resources for you guys on that as well. Alicia, our pivot in Allstate in New York State. No, New York does not allow short-term medical products, so that is just a hard stop there. Danielle, maybe I just do Oregon. That's probably the difference. That was in regards to the short-term medical underwriting. Yeah, there's some state law again that plays into that, so some states might just have only guarantee issue plans from a certain carrier. Kelly asked, do you see better pricing from Pivot versus UH1 Golden Rule? Totally depends on the area and the age of the clients. These are age-rated products. Some areas Pivot's gonna be more competitive, some areas UHC is gonna be more competitive.
Makes sense.
Alicia, can you put the refresher link here? That was for the compliance stuff. I can put that into our follow-up email, and if you
There you
wanna
go.
hang out for just a second after the Q&A, I'll put it in the chat too. I just need to take a second to get it.
Mm.
Kelly, short-term Wisconsin, 12-month duration now. Yes, you can sell Pivot and Allstate plans in Wisconsin for actually up to 18 months. They'll allow a 6-month renewal.
Is there a deadline for pivot contracting?
Nope, contract anytime. Just let us know. You can get appointed in a week.
And can you enroll in a short term on the first of the month or the next day?
Any day. Short-term medical is
Nice.
underwritten any day of the month, even the
Okay.
last 3 days of the month. So great question. Those are very flexible in terms of how to enroll. Michelle, Common Ground is leaving the Wisconsin Fox Valley area and it's a big void. What are your thoughts on this? Yeah, I heard about that. We haven't brokered Common Ground. Traditionally, we haven't had a contract with them. I know they merged with CareSource this year, which we do broker, so we might have some opportunity with that in the future. But yeah, Fox Valley, Brown County, Calumet County area from Green Bay all the way down to Neenah, Appleton, they are definitely a big player. I think we're going to see Anthem come in and be a bit more competitive in that area. I think UHC has been, trying to make more of a competitive push. They were in Brown County last year. So I think we're going to see some carriers come in and really try to fill that void there. But that's a good question. Does JSA have any contracts with ACA in Washington State with Washington Community Health Plan? No, we do not at this time. We have a few products in Washington, but it's usually some of those more local players that we aren't brokered with yet. So we will slowly flesh out our product suite for you guys. I'm going to include our full product catalog in the follow up for you. Zon
Alicia,
is in the chat. Go
uh,
Washington for the win tonight against the Packers. Gonza, we were shouting you out earlier. What the?
Alicia wants to know if she can contract with JSA if she's certified in the state base exchange for New York. Oh, not New York.
Yeah, New York is
I was about to say, get excited. We don't have any
so.
contracts in New York.
Yeah, so Anthem technically offers a product in New York, but it is, as far as I know, non-commissionable for agent sales. So we really just don't contract agents there. Frankly, I would look directly through the New York exchange if you're interested in contracting. We don't have any commissionable products there right now. There are definitely their own little bubble in terms of health insurance.
Back at DACA, Alex, any recommendations
You
for
recommend for
DACA
DACA
recipients?
recipients? It's difficult to say. It definitely depends on where they're coming from. If they need health insurance, I would certainly look into there
Yeah.
are
International plans or
yeah,
travel?
they're essentially like what's the word I'm looking for? Like catastrophic coverage for foreign nationals in the US, either on a more permanent or a temporary basis. We work with one carrier called Peterson International Underwriters. They do a few like kind of travel and foreign national insurance plans in the US. I'll be honest with you though, it's going to be limited options. 100%. If they're taking away the ACA from those folks, it's going to be limited options. I don't think that's going to be a huge demographic unless you're really ingrained with one of those communities. But
And
if you
you
are,
could that is actually a great partner to have is communities or agencies that do deal with DACA and other immigrational statuses. Does Pivot still offer policies for people with no social security number?
yeah, Pivot's actually one of the few. The only thing they really ask is that you've resided in the US. I'm pretty sure
Mm.
it's for the last 6 months. It could be the last three. Don't quote me on that, but that's part of their underwriting process. But they don't ask for a short term or rather a social security number.
Is short term available in Washington?
I need to check a product availability chart. I don't think so. Here, let me take a quick look.
Go
This will
for it.
probably tell us our answer. Yeah, if Pivot's not there, they are in pretty much every single area where short term is available. I don't believe there is short term in Washington. Again, kind of based on state law like California and New York. So I'd be pretty confident in saying no, but let us know.
Alicia, don't move out of New York. Just get licensed to sell in other states. Need to move.
Colette, is short term available for DACA recipients? Yeah, if they've resided here for at least 6 months, you could write them with like a Pivot health plan, for example. Just depends.
Good enough.
Zonta, I know you weren't kidding. I'm sorry. But yeah, no, Green Bay's gonna crush it. They're looking good already this year. But hey, appreciate you having me here, boss lady. You're the one that makes it all happen.
Zonta's on. That's our leader, Zonta Turner. And Zonta, I know you're in chat. They want to know if we can sell some swag.
Did we get a question about the
Get a
shirts?
lot. So more to come, guys. We'd love for you to represent ACA with JSA out in the community. Another idea is also I have t-shirts that say community agent, and these are worn by agents for Medicare and ACA, interchangeable. So just
Yeah,
t-shirt ideas. We don't have them for sale yet, but maybe we'll go into the swag merchandising industry.
yeah, we're gonna have to
Retire.
buff up our swag shop or the JSA Pro shop with some more ACA related stuff for sure.
Right, Rebecca, we should do swag giveaways. You know what? I've got something. You're right. Next podcast, we're gonna definitely do that. Let me make a note.
People love the shirt.
Mm.
They want the shirt.
People talking, we listen to the market.
Do a
What
giveaway today for the shirts. Hey, you know what? What I'll do, Zonta, is I will take all of the attendees for today, anyone who attended the program at one point or another. I'm going to put you guys all into one of those giant spin the wheel things online, and I'll spin the wheel and we'll give away shirts to maybe a couple of you.
So this one,
Yeah.
Zonta, pick a random number.
Giveaway 10. All right, we're going to do 10 giveaways. So I'm going to put all of the attendees, not the
Okay.
registrants, just you fine folk that attended the presentation today, into a giant wheel. I'm gonna spin it, and I will announce the winners in the, follow-up email. So,
Nice.
we'll get some swag out to you guys. You
All
deserve it.
right. Should I make some what do you guys wanna see? Hats, earrings, maybe for the future?
The earrings, well, QR code earring.
I have some T-shirts. Uh, yeah, that's right, Rebecca. You get a shirt, and you get a shirt, and you get a shirt. I
We
love
need
it. You guys
a
love our shirt.
we need
Fun.
some car magnets too. So, I'll announce the winners, and then, we'll get something together for you guys. We'll send out, like, I don't
Yes,
know, a survey or something. We'll collect your sizes and your address.
Sandra, we will make
So
sure we get your sizes so they fit because I do have shirts I can give.
So yeah, I'll announce those then in the follow-up email either tomorrow or Monday. keep an eye out for that. And anybody who wins will get in contact with you directly. So good luck. Good luck. Thanks for being here. You guys
Uh,
deserve it.
well, I guess that comes to our end, Alex. Sad to see you go, but we'll see you again the second Thursday of each month at 1 o'clock p.m. Eastern Time. Please join us again for Let's Talk ACA. Thanks, guys, for joining us. Have a great day. Email us for any questions, and we'll see you next month.
Thank you, everyone. Have a great afternoon.
Bye now.